Hi, I'm Dr. Kumarswamy, working as a consultant and head of the department, Emergency Medicine, Fortis Hospital, Bannerghatta Road, Bangalore. So I'm here to give you tips about first aid to be done as a layman to such trauma victims. So what is a first aid? It's an immediate care given to victims of road traffic accident till the help arrives or till the ambulance arrives or the medical fraternity comes in to take over. So what I can do if I encounter a victims of road traffic accident, the first aid. So let's talk about the 5 things as a part of the first aid in road traffic accident victims. The first thing is you should allow them to lie in the same position which you found them, and you should make them lie still the way they are lying. You should never allow them to move unless it is extremely necessary to save a life. Meaning, you should never mobilize them or turn them to one side, this way, that way, and keep them lie still, because it's very important. That saves your spinal cord, or if there is an injury to your back or the spinal cord. And the next thing is, if they are bleeding, they have gotten multiple bleeding wounds anywhere, that bleeding can be stopped by gently applying a simple pressure bandage with a clean bandage cloth or a clean cloth. So which is very important, which can be dangerous if you don't stop, because this first aid as a part of the stopping or arresting the bleeding is very important on site, because they may bleed to death on site. The person loses more than 40% of his blood from his body. The person will go into shock and he may even die on spot. If possible, lift that part of the limb is above the heart level, which reduces the risk of bleeding further. The next important thing is, if the person is not breathing or unresponsive, you should know about the CPR, and that is called Cardiopulmonary Resuscitation. That is pressing on somebody's chest very vigorously, hard and fast, 30 times, and blowing 2 breaths, rescue breaths into his mouth is important. I think that can be learned as a part of the basic life support in your nearby clinic or the hospital. The next thing, most important, is if person is drowsy, is not talking to you, is in altered mentation, or is restless, it means the possibly this person is or victim is in shock. So how do I address this shock? It is very important, keep the person lie flat. If possible, the abdomen and the legs can be lifted above the heart level, so that blood flow to the heart will increase, and to some extent shock can be addressed on site. So this is very important, that keep your torso and the legs above the head level if possible. And next important thing is, suppose they have got a broken bone and there is a deformed limb. It is very important. So what is called as splinting, and you can use any nearby resources like a wooden plank, iron rod, and you can use them to splint the part of the limb. So you can just rest them in a neutral position and strap it to that wooden plank and leave it alone. That reduces the further damage to the muscles, nerves, arteries, blood pipes, and also reduces the further risk of bleeding, and also it gives a better relief in terms of pain. So if it is a closed wound, meaning the fracture ligament, means the fracture of the joint, dislocated joint, there is swelling significantly over the joint or any part of the limb, you can do one first aid, which is very important. So you can use an ice pack, which can be put inside the clean cloth or a plastic bag, and we can compress. This is called as, please remember, any fractured limb within a closed swelling, so it can be treated as you can rest that part of the limb not to move, and apply an ice pack and immobilize and splint that limb, and then you can refer them to a nearby hospital. The first aid is simple: rest and apply an ice pack and splint that part of the limb. Suppose the person has got a severe head injury, he is unconscious, he is not talking to you. You can maintain his breathing by just lifting his jaw up in this way without moving his neck. That is very important to prevent further damage to the spinal cord. You can just lift the jaw upside and hold it there. You will have a valuable time till the help arrives. So these are all some of the first aids that you all can carry out as a bystander when you come across victims of road traffic accidents. And further to this, it's very important to keep them safe and prevent them further damage, meaning take them to a side if they are in the middle of the road and prevent further damage. So what is happening by following all these first aid techniques, and also refer them to an appropriate hospital equipped to deal with such polytrauma patients. So hope this will help you. Thank you.